tried to allude to that. The Clinton reform in 1993 didn't have confusion. We knew there was a cost issue, but that was about coverage. And the uninsured, and that was the major fight. The public knew about it, etc. I think today's effort, while having a better chance, right, is murkier. And I think there are some problems with trying to bring the cost and coverage issues together in a way that the public understands it. And I don't know whether the best thing to do is to brainstorm as to how to do that, or to drop one publicly and make the case on the other. As I recall, the debate between Clinton and Obama during the primary, Obama talked mostly about cost. That's what he was. Hillary talked about mostly about coverage. Well, gladly they put the two of them together, but it's not an easy message. And he did make a great case in why you, the public, should be worried about the uninsured and do something about it. But when he got to the point about saying, this is how we're going to get the money, I think there's some disconnect in the public. Yeah, we should bring in this 47 people, and this is going to cost less money. How does that work? There's something missing there, and it may have to be missed, and we get through it anyway, or maybe a better message can be
I think there's no way to separate them, unfortunately. There was an attempt in the Clinton era to do that, and I think it failed. Why did Obama campaign on the issue of cost? Because that's where the majority of Americans feel the problem is. Most Americans have coverage, and certainly most voting Americans have coverage. So their real concerns are about costs. And in addition, he hopes that he can sell the coverage issue connected to costs. But I think he rightly believes that you can't tackle health insurance reform without also tackling the cost issue, even though that then makes it politically incredibly complicated for all the reasons that we're all talking about. But if we don't bring down the growth in healthcare costs, then as Obama said this very clearly, and I thought he said it rather cleverly toward the end of his press conference. He said, if somebody came up to you and offered you a plan that said healthcare costs are going to double in the next 5-10 years, and we're going to be spending more money as a society, you're going to be spending more money as an individual, or you're likely to lose your health insurance coverage, would you accept that kind of a plan and say, I want to vote for that? The obvious answer is no. But I think that's the selling point. I think it's the difficulty, and maybe the point at which this could very well collapse. But I do think we have a great opportunity in the next month when Congress is home to try to drive home these points. I really encourage all of you to show up at town hall meetings the members of Congress are likely to hold in their districts when they're home, to get your voices heard, and bring people to their offices to make sure that they hear the message from you and all of you.
Let's give a hand to our speakers. And next, ladies and gentlemen, Dr. Scott Grace, who is the Senior Policy Analyst for the California Budget Project, is going to present some information to us on the state budget, status of what's happening with what has happened with our state budget. Prior to joining the California Budget Project, Mr. Grace worked as a researcher. Well, he's worked in the California Budget Project since 2002. He worked as a researcher in Austin, Texas for the Tomas Rivera Policy Institute, Consumers Union, and the Public Policy Clinic at the University of Texas at Austin. He also was a Californian Executive Fellow and worked as a reporter for newspapers in Arizona and California. Mr. Grace received his PhD in political science from the University of Texas at Austin and his bachelor's degree in government and journalism from California State University in Sacramento. He flew down today from Sacramento to tell us and talk to us about the budget, and he's going to get ready to catch a plane back in a little while, and so we thank you so much for coming to talk to us today about the state budget. Dr. Scott Graves.
Good afternoon. Yes, I'm sorry I'm going to have to rush out of here at 3:15, but that means you guys get back on schedule. I've got to walk over to Union Station, get the train to Burbank, get on the plane back to Sacramento. And they're actually not, some of you may have heard that there were floor votes scheduled for today on the budget bill and the trailer bills. Apparently they're being postponed until tomorrow. Unusually they decided to give a little time between actually writing the bills and actually voting on the bills so that members of the public and the legislators themselves can see what is actually in this 28 bill package. As I was getting on the plane this morning in Sacramento, I happened to pass by in aisle 1 a woman reading a book called What in the World is Going On? And I thought, I have to open my talk with that. That is perfect. Because I always get asked that. I don't come down to LA too much, but it's sort of like 2/3 of Californians live down here. But most of the political action on the state level is up there north of the Tehachapi, and there's always sort of a sense of what in the world are they doing up there? So in the interest of time, I think I'm going to just move right into my presentation, but I did want to give you the idea that what I'd like to try to do today is to give you some ways of thinking about why we're in this mess we're in today. I mean, what they're going to approve tomorrow or some other day eventually is the most significant retrenchment in state services that we've seen in many years, and it's not clear how or when we get out of it. So, I mean, it's very serious. Unless you're in the education world, a good thing that they've written into the bills a promise to repay over $11 billion owed to K-12 and community college education through Proposition 98. There will be a restoration of funding for those segments of the budget to the extent that money becomes available in a couple of years, which isn't a guarantee, of course. But the healthcare sector, social services, there's no guarantee that there will ever be a restoration of funding, although that is something that we're going to be working on diligently at the California Budget Project to both document the harm and the need for restoring levels of public services that we're seeing kind of ratcheting down at this very moment. So you know, really the overview here, the big takeaway point here is if you remember nothing else about what I say today, is that a flawed process leads to a flawed outcome. So we would argue we've been seeing flawed outcomes at the state budget level for several years in a row, and it's not because the gods don't like us, it's because we have a flawed process for making public policy in California, and our most important public policy document is our state budget. That's where we lay out our values, our priorities as a society, and we don't really like the way our things are going in terms of, you know, a statement of values and priorities in the budget that they're about to vote on. That's the big picture. Then, sort of just below that are these 4 points here. The first is you can't understand California politics and where we are today without knowing that policymakers love to give tax cuts, and that tax cuts are the primary reason why we find ourselves, from 2000 until 2008, with a constant structural deficit, always spending more than we were taking in. You have to understand that, okay? Tax cuts were the primary driver leading to the shortfalls we face.